Welcome back. In tonight's Health Center, I talked to an infectious disease expert from Johns Hopkins University about the upcoming flu season in the middle of a pandemic, something he says could be a double whammy. We discussed the similarities in the two viruses, what we can expect, and more importantly, how we can all prepare. In Harriman, Utah, cheerleaders in masks get ready for the first high school football game of the season. A woman hugs her husband in Houston, Texas, as paramedics take him to the hospital after several family members test positive for COVID-19. And in Hilliard, Ohio, Patricia Waters braces for an unconventional school year for her son Alex, a 7th grader who is nonverbal and lives with cerebral palsy.
It's just an emotional roller coaster.
Like Patricia, we've all had to come up with a new normal during the coronavirus pandemic. And experts warn, as the weather turns cold, we'll have to do it again.
With both of these viruses hitting our population together, we are greatly concerned that the risk of overwhelming our health system again raises its ugly head.
Dr. Alan Labreque is an infectious disease expert and professor at Johns Hopkins University. He says respiratory viruses like COVID-19 and the flu thrive in colder months because people head inside and there's less circulating air.
How do you think COVID-19 will impact the upcoming flu season?
One of the concerns that we have going into the flu season is what we're looking at as the 1-2 punch, if you would, of a flu epidemic that happens every season and costs us tens of thousands of American lives every year, combined with the ongoing epidemic of COVID-19.
According to the CDC, vaccine manufacturers will have extra flu vaccine on hand this season to reduce the spread of influenza. In mid-August, 13.7 million doses went out nationwide, and federal health officials recommend people 6 months and older get the flu vaccine no later than October to give the shot time to work. In Massachusetts, flu shots are required for all kids who attend K through 12 and young adults attending colleges and universities, a mandate prompting mixed reaction in the town of Chicopee.
I would much prefer my child to be protected and to protect the lives of other children as well. I mean, if that's all we got for now, why not just go for it?
People want to get a flu shot. That's their own opinion. That's what they want to do. You can't delegate that we should have flu shots, especially our children.
Despite differing public views on the flu shot, Dr. Labreque says his advice is simple.
I think it's really important that people this year, of all years, make sure to go out and get their flu vaccines. At the very least, we have a tool that we can use to reduce the burden of the flu epidemic that we know predictably happens every year.
Also important to know, it can be difficult to tell the difference between COVID-19 and the flu. Symptoms are similar and can include a fever, chills, cough, sore throat, and difficulty breathing. But according to the CDC, if a person has the coronavirus, it could take longer for those symptoms to develop, typically 5 to 14 days after infection, whereas flu symptoms usually show up 1 to 4 days after infection. Either way, a test is needed. And unlike the flu, there is still no vaccine available for COVID-19.
Is COVID-19 deadlier than the flu?
We don't know the answer to that, but I think our current data suggests that it's at least 5 to 10 times more deadly than the seasonal flu.
Do you suspect there will ever be a time when we don't have COVID-19?
Most experts currently agree that SARS-CoV-2, the virus that causes COVID-19, is likely to continue circulating in human populations for years to come.
Years to come. That's the bad news. Well, flu season in the southern hemisphere has not been as bad as normal, experts say, in part because people are wearing masks, they're social distancing, they're following those proper procedures. However, it is too soon to tell if the same will be the case in the United States, which is why the CDC is urging people to get the vaccination for the flu early. Now, flu activity tends to increase in October. The flu season peaks generally from December to February, but it can last through May in some cases, and we really don't know what's going to happen when the weather turns cold. That's the scary part.